everyone, I'm Sorcha. I will not go over time because I have put hardly anything together, but hopefully it'll give you an idea of what the Emotional Wellbeing Passport is, for those of you that don't know. This elusive space bar. Okay, so just a little bit of context about the Emotional Wellbeing Passport. It's a small little document that's owned and led by patients on the ward. So the Darwin Centre is an adolescent unit. We work with young people from 12 to 18, up to 18 with severe mental health difficulties that can't be managed in the community. So a lot of the young people that we see really struggle with communication, verbal communication, and keeping themselves safe, and struggle with self-harm. So the reason that the Emotional Wellbeing Passport came about was because, not so much now, but in the past there'd needed to be quite a lot of A&E attendances, or young people going to see other professionals due to incidents on the ward or hurting themselves. We try and provide lots of different forums for young people to communicate their feelings and for us to learn about them and know them other than just talking to them verbally, and the Emotional Wellbeing Passport is one of those. So this can be taken away from the ward with the, it's written by the young person, filled in by the young person, and can be taken off to appointments, outpatients appointments, A&E departments, school meetings, to support them to be understood and for their individual needs to be recognised without them having to explain them. So yeah, it can reduce the need for verbal communication or repetition of sensitive or emotive subjects. So quite often, when young people did go to A&E and perhaps they'd hurt themselves, as part of the assessment, the doctor that saw them or the nurse that triaged them would have to ask them quite personal and intrusive questions around their mental health and perhaps the reason that they'd done what they'd done in terms of the self-harm to themselves. And that alone could be really triggering, and did on occasion actually lead to an incident where, as somebody mentioned earlier, security did have to become involved, and really unpleasant and distressing, traumatising scenes would play out in an A&E department, which was something that we really needed to stop and needed to avoid. And since this has been up and running, we have found that there hasn't been subsequent incidents like that. So the front page just says this. It's designed to help you and I understand what would be helpful. Some of the questions and statements in there are these, the kind of things that might be not helpful, saying, so these are quotes from patients, anonymised quotes from patients, and some people find the complete opposites helpful. Some people want to be left alone, and some people want someone to talk to. In a 5-minute consultation in A&E, no matter how good you are at assessment, you're not going to build that level of rapport, and we recognise that. So this can help people to just have a head start on getting to know that young person. Kinds of things that can be soothing, thinking about sensory things, kind of things to notice when I'm struggling. When I'm settled, you might notice these things. Risks, helpful personal place to contact if I am struggling. And these are things that people who know me would think would be useful for you to know. I may disagree, and we found that one got filled in quite often, and that was quite helpful, that they could recognise that a friend or a parent would know that they need something even if they don't feel they need it for themselves. So yeah, that's the Emotional Wellbeing Passport. I think it has helped. We've recognised that we need to develop links with acute hospitals. DT, the children's ward at Addenbrooke's, we've started doing experience days, taking our staff over there for the day we're going to set up, and paediatric nurses from there coming over to us, shared learning on the back of clinical reviews and SIs, and recognising that actually we can't do this on our own, and the patient can't do it on their own. We need to work together across disciplines and across sites to support young people as best we can. So the Emotional Wellbeing Passport is just a tiny little part of that. So thank you so much.